Welcome to the Behavioral Health Best Practices Program. I'm your host, Dennis Streeter. This program will introduce you to the Behavioral Health Administration's new Behavioral Health Quality and Access to Care tracking system called the Performance Hub. The Behavioral Health Administration is the state administration responsible for ensuring all people in Colorado have access to quality mental health and substance use disorder services, regardless of where they live or ability to pay. BHA will help bring together community groups and government agencies to design a behavioral health system for all people in Colorado that is easy to access and offers high quality care that considers the whole person and their needs. As required by Colorado law, the BHA was to create a performance monitoring system to track capacity and performance of all behavioral health providers, including those that contract with managed care entities or behavioral health administrative services organizations, and to inform of any needed changes in the behavioral health system in the state. Here to discuss how the new Performance Hub works is Jordan Bass, Director of Data Science for the Behavioral Health Administration. Jordan, thanks so much for being with us today.
Thanks so much for having us, Dennis.
Okay, the Performance Hub is a tool that you were very instrumental as part of a team that created to help people understand the metrics used in getting data behavioral health systems. You want to kind of give us an overview of how this came about?
Absolutely. I'd love to get into that. The really exciting thing is Performance Hub was really developed with community feedback. So we really reached out to folks to understand what they were hoping to learn from our behavioral health system. And we used that to navigate what can we put out in the community. So with that said, on July 1st, I'm so pleased to say that BHA did launch a new public-facing product called Performance Hub. This product did stem from a legislative mandate to deliver a performance monitoring system, but we really did harness this fantastic opportunity to create a resource that creates transparency and measures our progress in transforming Colorado's behavioral health system.
This was a collaborative effort involving all the various stakeholders in the state's behavioral health system. Would you share with us how that all came about?
One of the exciting things to me about how Performance Hub was developed and continues to be developed is the value of iterative development. So while BHA had a requirement to put out Performance Hub on July 1st, we're not stopping there. And that is very much reflected in how the original tool was built. So we started out with a dual-pronged approach. We needed to say something about the ability to access care in our system. And the ability to measure is that quality care. So we started with that lens. We then talked with community members and providers to understand when you hear access and quality, what metrics come to mind for you? How would you measure that based on your own experiences in the system? From that, in addition to talking to our agency partners, we were able to distill down a list of metrics that really did deliver that value. However, I'll say that list was very, very long. So there was absolutely a need to prioritize what we can deliver now versus what we want to deliver in the future. So with that said, we were able to roll out a subset of metrics on July 1st that speak to mental health, substance use disorder, and complaints and violations. However, we do have a whole host of additional metrics that we do want to roll out in future iterations. So with that said, we are really looking to members of the community, providers, and also individuals at state agencies to help us prioritize what comes next. What would folks like to see in our roadmap? Do individuals want to see crisis? Do they want to see child and youth metrics as it relates to our larger child youth implementation plan? There's so much opportunity here, and we really are looking to create a community of how we move this product forward.
Generally, people feel that data alone doesn't tell the whole story. Your team has taken a unique approach to this issue to gather stories from people dealing with behavioral health issues to humanize what's going on in actual communities. This was very valuable information in putting together the data for the Performance Hub, wasn't it?
In our conversations with community members and providers, we often heard anecdotal information that actually backed up a lot of the numbers that we were seeing. So, for example, when we look at the map of Colorado and really see where folks are receiving care at a county level, working in data, I'm very used to seeing, we see the bulk of data existing around our cities. So we'll see a lot of activity in Denver, we'll see a lot of activity in Colorado Springs and Grand Junction. However, when you pull up maps in Performance Hub, that's not the story that's being told. And it wasn't until we talked with our providers and community members to understand the intricacies of what care looks like in those communities and the culture that surrounds it that we were really able to marry this incredibly important anecdotal lived experience with the data that Performance Hub was showing. And together, that tells a comprehensive story. And that is how we actually drive system change for behavioral health.
Okay, now you're going to walk us through the Performance Hub webpage to show what information we can access. I'd like to add that I'm a member of the Behavioral Health Planning and Advisory Council and serve on the Federal Health Block Grant Committee to advise the BHA on uses of the funding. One main issue we had was the lack of information on programs being funded and how to measure their effectiveness. The Performance Hub was a big part of the solution to that problem. Jordan, you did the following presentation to our committee, and we found it very helpful on how to access the data. So why don't you go and show the rest of us that presentation?
All right, let's get into our demo of Performance Hub. So as we already talked a little bit about, Performance Hub serves as a publicly accessible data bank for behavioral health data with insights, data sources, and visualizations that were informed and prioritized by the needs of providers and communities with lived experience in our system today. BHA will continue to collaboratively develop Performance Hub as informed by what the people of Colorado want to see over time, but this is what it looks like today. So if you were to Google BHA Performance Hub or Colorado Performance Hub, all of those will take you here, which is our home page on the Colorado BHA website. This serves as our landing page for all Performance Hub data. Scrolling down the page a little bit, you will see a variety of different topics that are available to explore. Data and visualizations are all organized by topic areas to help create a guided experience in navigating available resources. Right now, we currently have 3 topics available. We have mental health resources, substance use disorder resources, and complaints and violations. We'll explore this a little bit more in a second. Continuing to scroll down the page, you will see that we have key insights available. So these key insights are intended to provide high-level overviews into Colorado's behavioral health system for very accessible takeaways. This is intended to create value regardless of a user's comfortability with or experience with data. So our first insights are as follows. We have approximately 112,000 people that received care at community mental health centers in Colorado in 2023. We had an average of 397 beds at SUD residential treatment facilities from July 2023 through April 2024. And then approximately 51,000 unique people received BHA-funded SUD services in 2023. The really exciting thing about this is all of these numbers come from Performance Hub. So you can use this as a jumping off point and then explore the different data and visualizations we'll see to learn a little bit more about what the data is telling us. Then, continuing to scroll down the page a little bit, you'll find an opportunity to join the conversation. Performance Hub, since day one, was intended to be both a community utilized and driven tool. So with that said, we're inviting folks to join the conversation wherever they are at. We do have a short survey available for folks to provide feedback asynchronously. So if you're looking through the platform and you're like, I really wish I could see this data, or I'm a little bit curious on how to interpret this, you can reach out to our team directly. Or we also do engage in public conversations where we are talking with communities directly to teach the tool, teach how to use the tool, just like we're doing today, but also take those questions and feedback real time. Then finally, we do have an additional resources section. So we do understand that behavioral health is just one part of whole person care. So we did want to provide additional resources that our team uses to help give folks an additional opportunity to really learn about the full context of individuals receiving care in Colorado today. So with that said, let's get into Performance Hub. Let's start seeing some data and visualizations. Let's go ahead and explore mental health. So when you click on a topic page, you will first see an overview that just tells you a little bit about what you might see on this page. You'll also see information about what data sources are being used in the event you want to explore this data a little bit more. Then, as you begin scrolling down the page, you will begin to see central metric themes. So our first metric theme is the number of people who receive publicly funded community mental health services per 1,000 people. Now, this metric theme contains a ton of different slices and dices of the data to really dig into this to understand what is the data saying from county perspectives, from state perspectives, and even demographic perspectives. When you're viewing a visualization, you can go ahead and hover over any of the data elements to learn a little bit more about how a specific value is calculated. This is intended to create both transparency and confidence in how we're using this data. Then, using the gray boxes at the top, you can navigate seamlessly between views without the need to navigate to separate pages. But regardless of what view or metric that you're looking at, the functionality of these visualizations remain the same. So once you understand how to interact with one metric, you can apply the same knowledge across the entirety of Performance Hub. This is one of my favorite views, as I think the demographic views in particular can be used to tell a variety of different data stories. So for example, let's see what demographic views are available for this metric. We have age at admission, ethnicity, race, sex, and youth age at admission. Let's explore that one a little bit. So this demographic view in particular excites me a lot, because this is one of the ways in which we were able to incorporate community feedback into how we developed out Performance Hub. We had talked with a advisory council on infant and youth mental health, and they had advised that there's not a lot of data today available for youth under the age of 18. They typically just see a 0 to 18 youth group. So we took that feedback, we did a little bit of research and exploring to see, could we break this data apart any more? And we found that we were able to. So we are able to provide data views that were unavailable for mental health in Colorado until now to learn a little bit more about these populations. Another view that really excites me is looking at just general age at admission. So let's take a peek there. So not only is this intended to be a publicly utilized resource, but this is also a resource that we internally at BHA are using. So if you look at these two leftmost clusters of columns, you will see that individuals under the age of 45 are receiving substantially more community mental health services than those over the age of 45. But why is that? Is it because those over the age of 45 don't have a demand for community care? Is it because they don't know how to access these services, or alternatively cannot access these services? Is it because they have insurance and so they're accessing private care, or they are paying for their own care, so self-pay care? These are just some examples of the questions that our data science team at BHA is asking to really begin to better understand gaps in accessing quality behavioral health care. So with that said, if you were to continue scrolling down the page, every additional metric that we have related to mental health is available to you. And then when you're finished looking into mental health, all you have to do is hit the back button on your browser and then select the next topic that you would like to explore. With that said, that is the end of our structured demo, but there is so much more to come. And we really do hope you engage with our team to tell us what you love about Performance Hub or what you'd like to see. We can't wait to hear from you.
Thanks for that great presentation. And I will have contact information at the end of the program for people to be able to get help with using the Performance Hub and offer any input as well. All right, Jordan, do you have any final thoughts for us about the Performance Hub?
The data science team at BHA was incredibly honored to have Performance Hub be among our new commissioner's top 5 priorities going into the new fiscal year starting July 1st, 2024. Some of the other priorities going to the new fiscal year were launching a new grievance and complaint process, launching our new safety net system, enhancing our care coordination system, and a continued work alongside our children and youth behavioral health implementation plan. These all really come together to say how BHA is working alongside communities to transform Colorado's behavioral health system.
Jordan, thanks again for taking the time to share this information about the Performance Hub. And be sure to come back on the program with any updates.
Thanks so much for having me.